Hello, everyone. My name's Lauren Lovelace, and I'm the Consul for Public Diplomacy and Public Affairs at the U.S. Consulate General in Chennai, India. And on behalf of the U.S. Department of State, I want to thank everyone for joining us today to discuss today's topic, fighting health misinformation and disinformation during the COVID-19 global pandemic. I want to welcome our audiences who are tuning in from across South and East Asia. We want to make this conversation as much of a dialogue as possible, so please be sure to post your questions and comments for our panelists in the Facebook chat box. I want to offer thanks to our partners in Sri Lanka, Nepal, Myanmar, Indonesia, Philippines, and Japan for joining Mission India today as we host this timely event. I also want to acknowledge the impact this global pandemic has had on all of our lives to varying degrees, and the importance of addressing the challenge of disinformation and misinformation. Now, I'd like to start out by briefly defining our terms for this serious topic in a more lighthearted way. Abraham Lincoln was one of America's greatest orators, and he is often quoted in motivational remarks. Some of you may have seen a post in your social media that I'll share with you now. Don't believe everything you read on the internet just because there's a picture with a quote next to it, purportedly said Abraham Lincoln. Now, did the 16th president of the United States actually say this? Obviously, no. But the image points to how inaccurate information can be easily and widely circulated as truth. To define our exact terms, we look to the UNESCO Handbook for International Journalism and Training. Disinformation is information that is false and deliberately created to harm a person, social group, organization, or country. By contrast, misinformation is information that is false but not created with the intention of causing harm. Whether intentional or unintentional, the negative impacts can be dire. So today we will discuss disinformation and misinformation in the context of the COVID-19 global pandemic. According to the International Fact-Checking Network, COVID-19 misinformation and disinformation falls into 5 categories. 1, content about causes, symptoms, and cures. 2, spread of the virus. 3, government documents such as press releases. 4, misrepresentations of comments, photos, and videos of authorities. And 5, conspiracy theories blaming certain countries, groups, or communities for the spread of the virus. A project focused on educating the public about vaccines also found that, quote, a vast majority of the 240 million digital and social media messages exchanges on COVID-19 by mid-March of 2020 were false or very misleading. So what do? We ask the experts. Join us today. I'm delighted to introduce you to Dr. Rupali Limaye, who is the Department of International Health, Johns Hopkins Bloomberg School of Public Health expert. She is joined by Dr. Alain Labrique of the Department of Health, Johns Hopkins Bloomberg School of Public Health, Dr. David Lazer, who is the University Distinguished Professor of Political Science and Computer and Information Science at Northeastern University, and Sunil Pravakar, who is a digital media consultant based in Kerala, India. Welcome, all of you. And also welcome to our hundreds of viewers who are having with us right now. I want to start out actually asking Rupali to help us define terms a bit more. Some commentators have referred to an infodemic that threatens our societies right alongside the recent COVID-19 pandemic. Does your research or the research that you're familiar with point to a misinformation or disinformation infodemic? And if so, what effects does this have on health outcomes?
Thank you so much for having me. It's a great question to start with. And I think when the pandemic started a few months ago, we were overloaded by misinformation, particularly on social media. And while I think that social media can provide a very much democratic platform for people to exchange ideas, unfortunately, in the context of this pandemic, it has led to an overload of information and, as you just mentioned, misinformation, and disinformation. The issue with this is that it would be okay if this information that was being circulated was not harmful. However, we know as a fact that misinformation and disinformation has harmful consequences. People have tried bleach, people have tried colloidal silver as a cure for COVID. Neither of those have been confirmed as having any evidence for being a cure for COVID, and unfortunately have led to deaths. So it's a real challenge for people to be able to discern what is real and what is not real. And one of the reasons behind this is that this accurate information is quite a moving target. So something that we found out yesterday from a scientific point of view might not be true today. So think about this from science. For those of us that are scientists that study this, we are also grasping with lots of misinformation and disinformation, but then move that forward and extend that to the public, the general public that might not have a versing in science, if you will, and that causes a major, major challenge, and people don't know where to look with regards to getting accurate information.
Thank you so much for that answer. I turn now to Dr. David Lazaire. David, could you offer any examples of where governments or law enforcement have successfully regulated public health discussion, as well as perhaps less successful examples of controls on speech in the media and social media? Thank you.
Well, it is actually hard to point to great examples. I think that we can see a lot of what the platforms have done in this regard. So I think platforms are trying to hold off on this flood of misinformation. But the challenge for platforms is that they are built for easy scalability, so as to handle massive amounts of communication without human curation. And so it's been really hard for platforms to keep up. The one thing I'll note that I think has been an interesting innovation, it's not even an innovation, it's sort of old school, is that in a fashion, the platforms, one of the things you see some of the platforms do is act as a broadcaster of higher quality information. So let's say if you go to google.com, they'll have a little blurb under the box that says 5 things you can do, or that kind of thing, which is simple, high quality information. And you've seen the same thing at times from Facebook and Twitter and other platforms. And so I do think that's an interesting centralized kind of intervention, sometimes which has been done in collaboration with government authorities. So you do see pointing to, let's say, CDC, high quality Centers for Disease Control content and the like. And I think that's not been preventing misinformation, but it's been promoting flooding the zone with high quality information.
Thank you very much for that, David. Turning now to Dr. Alain Lebric. Alain, Johns Hopkins, where you're based, has a COVID-19 dashboard. And that is one example of a well-known and well-respected American research university providing a public service to the world. The question is, whose role and duty is it to provide accurate public health-related information to the public? And building on my question just now to Dr. Lazaire, whose job is it to correct the record if there is disinformation or misinformation?
So let me take your second question first and just say, there have been a few governments that have enacted legislation to take harsh measures against individuals or groups that are purposefully spreading misinformation or disinformation to cause chaos or uncertainty in the general public. And of course, that leads to a slippery slope where the boundary between promoting disinformation and spreading this freedom of speech is often blurred. So I think it's a difficult place. But accurate data is really the crux of any good epidemiologic response. Without timely, correct information during times of a pandemic, we end up flying fairly blindly. And so we don't understand the extent of the epidemic, who it's affecting, and whether measures that we're taking are actually addressing the problem and are having an impact. So it's critical to understand how resources are being used, what measures should and should not be taken by the public. And this is especially true during a time of pandemics. So I think, as Dr. Lemay pointed out earlier, new pathogens are are usually accompanied by high levels of uncertainty. So the public looks to science for solid answers, and we don't always have them. There's a lot we don't know about the virus during these early days, how it's transmitted, how well it can survive under different conditions, and how best to prevent it. So because of this, I think we see people turning to their social networks for answers. And social media can be a way to fill in some of these vacuums. But unfortunately, those vacuums are often filled with conspiracy theories and false information. And as Dr. Lemay pointed out, it's outdated information is almost impossible to remove and replace with better information. So it's certainly a challenge to stay informed and keep people up to date. It requires a massive global coordination of common data and common gold standard messages, which the UN and WHO have tried very hard to accomplish. As to whose responsibility it is, I think it's both government and scientists to put out correct information, but it's also the public's responsibility to stay updated and to learn how to source the information that they're reading. Public health scientists are getting better at communicating, but compared to the pace of misinformation that's created, we in public health tend to be generally a bit slower and a bit more cautious, and sometimes, admittedly less innovative in how we disseminate important messages. I think the other thing, Lauren, that's worth mentioning is, in sharp contrast to the way things were a mere 50 years ago, people today have created a media bubble around themselves, selecting sources of information which they rely on. There was a study recently that found uncertainty about a health decision like the MMR vaccine. People are much more likely to turn to social media to make a decision than to go to authoritative health sources. And because we don't any longer have a shared local or regional source of a unified message, except in very authoritarian states, we find that these media bubbles make it very difficult to distinguish truth from falsehood. And so as David points out, these large social media companies also, I think, in addition to government, science, and the public, play an important role in helping to distinguish between valid and suspect content.
Thank you so much for that answer. And you pointed to the importance of media organizations. I'd like to turn now again, back to Dr. Lemay, just asking, about media literacy. I'm here in South India right now, one of the most literate populations in the world here, but it's a program that we've been working on has been focused on media literacy and countering disinformation in non-English regional languages here in South India. Can you speak a bit to what is media literacy and how does it help the public and media professionals to more effectively recognize misinformation and disinformation and help the public source that kind of information, that accurate information that Dr. Labrik was mentioning?
Mm-hmm. Sure. No, it's a great question. And I think the way that I would describe media literacy, it helps people understand the assumptions that media has and why media would present something in a particular way. So media literacy would allow and help people to figure out what is true and what is not true. So I would suggest, especially within this context, that there are several aspects of media literacy that are quite relevant. So the first I would say is that media is very carefully constructed, meaning media will tell you how to think about something. They will provide content, they might have visuals, they might have graphics, but they use something called framing. And what framing does is it defines how news media coverage shapes mass opinion. So just in terms of the language that is used, the visuals, the accompanying sort of other elements, if you will, with regards to outside of the content of the story. One thing that we have been finding with regards to this pandemic is a lot of media are using these sources that are very connotated with war-like meanings. For example, we're hearing things like monster, storm, and tsunami when we're talking about the pandemic. That really affects the way that the public will express their feelings or their opinions or understand the pandemic. So I think the second point with media literacy that's important here is that the meaning of the message is very conceptualized and can differ between the media and the audience, right? So depending on, one way to think about this is that how might different audiences think about the way that we talk about COVID or that the media talks about COVID differently? There's different interpretations. People have different ideas of what meaning is behind specific words. And so that can also be a challenge. I think the third, maybe most important thing with regards to authority and trying to understand whether or not we should believe science within the context of misinformation is that media also convey values about power as well as authority. There is an agenda. So there is a specific point that media is going to want to get across. And why are these aspects important, right? These three aspects that I just went over. Well, part of the issue is that we're also dealing with a very, very polarized world. Compare us to 20 years ago, and now we have very, very strong polarization related to political ideology, religious ideology, and so on. So as a result, science sometimes is seen as just another voice in the room and perhaps not as quote unquote the truth. And that's a real struggle for those of us that are working in public health. In addition, as I mentioned before, and Dr. Labrik also mentioned, is that as social media has exploded and has broken down this sort of digital divide where more people are getting access to information than ever before because of the innovation that we've had in digital technology, social media has also contributed to something called confirmation bias or echo chambers, right? So people that you turn to from a network perspective are people that already believe in the same attitudes and feelings that you do. And that can cause a real challenge because that does not allow for any diversity of opinion.
Thank you so much. Fantastic answer. We will have to have you come and be part of our future programming on countering disinformation here. That was a great answer on media literacy. I want to turn now to Dr. Lazare. Just asking a question to you, sir. The U.S. Centers for Disease Control and Prevention, the CDC, outlined specific recommended benchmarks for communities to use as they transition from lockdown to phased reopening. Worldwide, how do you see, and this is getting to Dr. Labrik's earlier point, this evidence-based scientific data being used to inform sound public policy, including in the reopening of economies and societies? So maybe some specific examples that you can share with us in that respect. Thank you.
Well, you know, there are a few issues going on there, and one is about political elites, and the other is about, we'll say, non-elites, regular people. And so there's the question of how much do elites listen to the science and to recommendations and guidelines like this, and the second is how does the public writ large hear that, and how does it affect their behaviors? Because one of the things that's particularly important here around a pandemic is the need for everyone to follow certain types of behavior. So you need sort of a certain degree of mass agreement and behaviors, because if people still go out in crowds in some fashion, the disease will continue to spread no matter what government mandates are. I think that we've seen high variation around the world, and certainly we've seen a lot of variation in the United States in how much governments have followed those guidelines. So certainly we've seen a lot of state governments starting to reopen things up, despite the fact that they haven't met those guidelines in terms of, let's say, 2 weeks consecutive decrease in the spread of the disease. Interestingly, certainly our survey research, we've been doing surveys, very large scale surveys in the US, show, for example, that the public in just about every state would say, let's hold off on reopening, but there's been a desire for various reasons by political and economic elites to move forward with reopening, despite the fact that guidelines, for example, from the CDC would suggest otherwise. So that isn't necessarily so much an issue around misinformation as much as, even if you have the right information, that may not, you'll still make decisions. There's no guarantees of coming to the right place, and we are in, unfortunately, very in a very uncertain place, certainly in the US and actually much of the world, in terms of the trajectory of the pandemic in different locations. It differs actually in Boston, where I live, it's been a rough ride, but is actually looking much better. But it's actually in other parts of the country is looking more problematic, and yet we see this loosening up both of the regulations by government as well as behaviors by the people. And so so that's where we are.
Thank you very much for that. I'm turning now to Alain, back to Alain Lebric. There's some insight into emerging research frontiers in the area of combating misinformation and disinformation. Specifically, I'm thinking about digital forensics or some of the areas that you might be working in that regard. And on the end of that, I'm just wondering if you could tell us a bit more about the COVID-19 dashboard at Johns Hopkins and how that tool, what the origin and the intended audience was originally for that tool, and how it might be refined, if at all, going forward. Thank you.
Thanks for that wonderful question, Lauren. I think there's been a lot of research over the past decade as social media and health messaging have been intertwining more and more intimately, and we've begun to unravel some of what was initially, I would say, mysterious around what the source of a lot of this information was and how it was spreading so rapidly. There was colleagues at George Washington University a couple of years ago examined social media messaging around vaccinations as a topic of focus, specifically looking at polarized and anti-vaccine content. And one of the things that they found was bots, that is to say automatic accounts that retweet and disseminate information, were central to spreading anti-vaccine messages. And these were politically motivated trolls that were focused on sowing discord. So human beings as well as automated accounts that helped accelerate the spread of misinformation. So these are not real people. These are accounts masquerading as legitimate users, and that creates a sense of false equivalency, that we have large swaths of the public who hold these beliefs on whether they are myths about coronavirus or incorrect information about vaccinations. And it's important to recognize, and countries around the globe have recognized that a lot of these activities have political agenda underlying them. And some, of course, have purely driven by the excitement of social media likes and shares. But by and large, there's a massive push for misinformation to be spread due to political agenda. In a recent study during coronavirus times, colleagues at Carnegie Mellon have actually looked at Twitter and the role that Twitter is playing in pushing misinformation about COVID-19. And to David's point, specifically around this concept of reopening America as an example. And one of the things that they found is about half of the bots that are pushing this misinformation half of the accounts pushing misinformation are actually bots. And so not even real human beings or real citizens expressing their own opinions. So what these tweets are trying to do is trying to sow division, increase social polarization during a time of great and complex social strife, and that's the pandemic we're currently under. So in the examination of, I think it was around 200 million tweets where they examined discussing COVID-19 and coronavirus, they found that of the top 50 influential retweets, 82% of these were bots, and 60% of the top 1,000 retweeters were bots as well. And so whether it's about the short list of inaccurate stories that you shared at the beginning, unproven cures, the false link between 5G towers and the coronavirus, there's just a plethora of misinformation that's being, I think, artificially exploded, artificially expanded from what really reflects boots on the ground.
Now,
With regards, sorry.
So when we talk about bots, though, I think it's going to be important to acknowledge that these are human-driven endeavors to have bots. I mean, it's not as if we've been suddenly, at least to my knowledge,
Invaded by
bots. The bots are coming from malign governments or malign actors, or individuals. So just you have more information on that, but I would just like to put that qualifier.
Absolutely. So that when I say politically motivated, and I think if I may just pass the baton to Dr. LeMay, we recently been discussing the fact that this is not novel, that this type of politically driven effort goes back decades, and so maybe if I may just ask Dr. LeMay to finish that question with some examples.
Sure. No, thank you, Dr. Labreque. I think, one of the things that we have been looking at is how does disinformation start? Why has there been such a movement? It's getting louder. What's happening? So in the 1980s, if I can give a little bit of context here, the Soviets put together and really extended this disinformation campaign that was grounded in a conspiracy theory that the virus that caused AIDS, for example, was a product of really biological weapons experiments that the US had led. And so this was in the 1980s, so we're talking almost 40 years ago at this point. And since then, the Russians, there's been work that's been done on this, is that the Russians have been using the same strategy, and they have a very, very simple approach with regards to these politically motivated attacks, as Dr. Labreque just referred to. So identify internal strife, which is what we're dealing with now, because we're in this very uncertain environment. We're very polarized here, especially here in the United States. Point to inconsistencies and ambiguities in the news. As I mentioned at the beginning, the science is changing every day. So as I said, accurate information is very much a moving target. What we thought was true yesterday may not be true today. And then what the Russians have tried to do from this sort of strategy perspective is then fill them with meaning and then just repeat, repeat, repeat. As Dr. Labreque mentioned, people in uncertain times are going to grasp for something that will explain to them what is happening in the world, to make sense of the world. And so as a result, that is one of the reasons why conspiracy theories are so popular. Sorry. Give me 1 second.
That's fine, Rupali. I can take the question onward. I think that we got the gist of it. I think that was, those examples, those historical examples are incredibly important moving forward. Did you have anything else to add there?
Yes, I'm so sorry about that. I'm so sorry. One of the things that we have been trying to look at is from a strategy perspective, to get to your other question, Lauren, is what can we do to try to mitigate misinformation? And one thing that I'm a behavioral scientist, this is what I study mostly vaccines. And so we've looked at something called inoculation theory. And the argument there is that you essentially inject someone with a weakened sense of a persuasive argument so that when they are actually presented with an inaccurate information in the future, they're able to discern that it might be misinformation and they're able to essentially protect themselves against it. And as Dr. Labreque mentioned, this has been a huge challenge for us working in vaccines. We're now seeing it play out within the COVID response. We all know that a COVID vaccine is imminent. It will at some point be here in the future. And we're already dealing with misinformation related to the COVID vaccine. And so this is something that we're going to have to tackle. And from a public health perspective, we're going to have to be more innovative if we're going to be able to do this effectively.
Thank you very much. I'd like to turn now to Sunil Prabhakar. Sunil is based in Kerala, where they have had a very active response and a very effective response to the COVID-19 pandemic, in part because of some long-term planning. Sunil, Kerala has received international attention. This is on the front page of the Washington Post and the Guardian for the state's active and to date very effective response to COVID-19. What makes the Kerala experience unique in your mind? And could you, given your experience as part of the Google News Initiative India fact-checking network, give us some tips and some steps that citizens can take to prevent the potentially hazardous sharing, unintentional sharing of unverified information? Sunil.
Thank you. Thank you. It's a wonderful question. Actually, it is about my home state. Kerala has tackled not only the current COVID-19 pandemic, but also the earlier health disasters, including the containment of the spread of Nipah virus and also the natural disasters with the death. The first case, actually, the COVID-19 first case in India was reported in Kerala by the end of January. As a student came from the Wuhan, as a medical student came from the Wuhan. This actually initiated discussions, and the swift action of the state government in identifying the possible social contacts and subsequently tracing them started showing results by April. The number then started decreasing. The sustained efforts by the machinery, the entire machinery, including the political leaders, health workers, police, revenue officials, etc., and started yielding results. And by mid-April, they actually reduced the number to half of the original. That was daily case. I mean the daily cases. Kerala, which is second in total number of infected cases in mid-March, actually slipped into 10th position by the first week of May. Now Kerala is in the 17th position considering the cumulative number of confirmed cases in India compared to different states in India. This achievement actually, this achievement of the state has attracted international attention, and both the national and international media carried a lot of stories on this. Now the numbers are increasing after the repatriation process, and presently most of the cases reported are from those came from abroad and other states in India. And considering the second question, the citizen has got a great role in preventing the spread of misinformation to great extent. Actually, the misinformation, that means the social media posts received by them in India, or especially in Kerala, WhatsApp is the main platform where the misinformation is spreading. And normal in most of the cases, these false information, this false message starts in phrases like according to reports are saying, it has been reported. And in most of our claims spreading through the social media will have a sentence, a phrase like this. Such media posts, they're generally introduced as per the WHO reports, as per the doctor treating a patient in COVID-19 patient in Britain or in Germany says, or as per the post from a medical student in Wuhan. Then if you see such phrases, if the citizens see such phrases in the messages, they may have a temptation to forward these things because it is reported by somebody in WHO, it is reported by somebody from Wuhan, and it is reported by a doctor in Germany. So they will have a temptation to forward such messages. So normally the people, citizen, don't share them. I can request the citizen that don't share them without locating locating or verifying the original source of such messages. They can keep in mind. Yeah, sorry.
That's yes, exactly. Go ahead. Please,
yeah.
Please.
Okay. Then don't share such messages because you may remember that you are responsible for the information you pass on. All people, everybody is responsible for the information they pass on, even in the social media. So even a simple Google search will reveal the fact. So they need to rethink whether this is to be forwarded or not, shared or not. And they can look at the official primary sources like the websites of WHO or the social media, Johns Hopkins University's dashboard, a lot of things available, and government is publishing a lot of websites through their health departments. So the people can depend upon such websites or things to get reliable information. And even the social media.
Yes.
Sorry, tell me. Yeah.
I say thank you for mentioning the importance of going to primary sources. That's something that is incredibly important when we think about how do you find accurate information, how do you fact check. Can I ask you a related question that's been brought to us? Some of our audience members are asking a question. I think this one also pertains to what you're saying, Sunil. A lot of information and misinformation is shared on WhatsApp. How do we know which forwards are genuine and which are fake? Is Googling that particular information always the logical way forward? I'd ask you to start, and then I'd ask for maybe Dr. Lazaire to follow up.
Googling, and you can depend a lot of tools. A lot of such things are available. Even the WhatsApp, the social media are they are actually offering some services, fact-checking services with them. If you go to the WhatsApp blog, you can see a lot of fact checkers list, the IFCN certified fact checkers, a list of IFCN certified fact checkers. That means IFCN stands for International Fact Checking Network, and you can see a lot of WhatsApp numbers there where they can send this information. In India, even a lot of agencies are operating, fact checking agencies, IFCN certified fact checking agencies are operating. So the people can send, share the messages received by them to these agencies and get the facts, get it fact checked. And the government side, the government of India is offering a fact checking service through the Press Information Bureau, where the things related to government, the information related to government can be fact checked. And even the Kerala state government started a Facebook page in order to, started recently Facebook page to combat the misinformation spreading through this. It made a lot of beautiful because, and police is taking action also. There's the public image.
Hold the question back then. So I think I saw Alan raising your hand there. I think, did you have something to add to that, Alan, or did I see you raising your hand there on that point?
I think so just to confirm, I think Sunil's point, going back to the primary source, if possible, is really absolutely critical. There's the number of false pieces of information that have been generated over the past 4 months that start with scientists at Johns Hopkins University claim that X, Y, and Z, or a famous scientist in Wuhan states that so-and-so. And I think that's one of the first and early points of inoculation that Dr. Limay talked about, is to help people identify these buzzwords that should trigger first an attempt to locate that primary piece of information, and then be prompted to reshare that throughout your networks. And I think that's a simple piece of behavior that if we can increase the prevalence of that behavior, check the source, go to the website of the institution, or Google the name of that scientist to see if you can find the original piece of information from that authoritative source, versus, as you shared so nicely in the beginning, Lauren, the picture of Abraham Lincoln stating something about misinformation on the internet. You know, clearly that's an implausible meme, but it's so easy to click on a picture with a quote next to it and be done with it and try to get more likes and shares than it is to engage in this proactive effort to look up a piece of information. The other important thing that I think deserves to be mentioned here is the concept of confirmation bias. So generally we like to hear pieces of information that confirm beliefs that we hold as individuals, and they may be beliefs about a conspiracy that the scientists around the world, or Bill Gates is spending his time to generate this kind of massive illicit activity around coronavirus. But I think we must try as individuals to even question our own sense of confirmation bias and look deeper at for the sources of where this information is coming from.
Thank you. Well said. Dr. Lazaire, just following up on the question that Sunil had raised, and also Alan, looking at the one of the primary sources, but also the challenge of WhatsApp as a phenomenon, very, very large here in Indonesia and across South Asia and East Asia. Can you speak a bit to that type of phenomenon where it's not as easy maybe to immediately check the primary source when you receive that WhatsApp?
So I think the big picture here is that there are many vectors for the spread of misinformation. And when we think about different corners of the internet, we might think of the role that Facebook plays or Google plays or WhatsApp plays. And there's a different logic to each of these vectors, right? So on Facebook, the logic is in part that it's your friend sharing it, and there is sort of a viral nature of it, but then that also creates a potential logic of other people commenting and constructively or not engaging with the content. And of course, if you're on your laptop, say, it's easy, depending where you are, it's easier to then look up and do the kind of confirmation or disconfirmation that Elaine was just talking about. What the other element there is that there is the potential for curation by the platform with Facebook and especially Google to say this is really information that's unreliable, and we're not going to allow it to be shared on the platform. With WhatsApp, the nature of WhatsApp is that it doesn't allow for your curation by the platform because it's all it avoids an entire curation process, and it's sort of invisible. It's even hard to study because we don't have the digital traces because of this, ironically, because of the security of the system. And that makes WhatsApp in some ways a vast dark matter of misinformation. We know that there's a fair amount of misinformation being shared on it, but there's no really good comprehensive accounting for it. And so, and obviously a lot of the research community, a disproportionate share of the research community on misinformation is, for example, based in the US, but this shows you this sort of interrelationship between cultural, country context and technology. WhatsApp is actually not that big in the US. And I think as a result, unfortunately, it has been somewhat neglected as a focus of study by US scholars because it's not the first thing that comes to mind in the US because it's not that popular. So,
opportunity for some great US research partnerships yes. Across South and East Asia, which we would love to encourage as yes. the State Department. What about this question of media literacy, getting back to these trigger words? And different places do workshops. I know that Sunil, you've led workshops in India. What is the best way to transmit or educate a public on these kind of trigger words that Ellen was mentioning, or on these challenges like the confirmation bias, framing? How can that be conveyed? Is it through mass media, or how can people learn about this aside from tuning in? And with that, I'd also like to encourage all of our viewers and audience to please keep your questions coming because we've got time for more questions. But can you answer that a bit, David, for me? What's the best medium for transmitting this kind of information to a broader public?
Yeah, in Kerala, I can give you an example. In Kerala, in the Kannur district, a district collector started a campaign in the schools of Kerala to familiarize them, that talk about them, of the misinformation and the problems of misinformation spreading through the school students. So awareness campaigns are the best ways to decrease this spreading of this misinformation, especially on the WhatsApp. And taking action in Kerala, in my experience, in some certain cases, government is taking or police department is taking certain actions, and these actions will normally create some kind of fear against people forwarding such messages. So the political action, the combination of the political, that means administrative actions, then the awareness campaigns and the education through even from the school system, all this will help in reducing the spread of just mis and disinformation in the public, among the public.
Thank you, Sunil. Anyone want to?
Yeah, sorry, Lauren. I was just going to say, for those of us that have been working with communities, as I mentioned, Dr. Labrik and I both work to increase vaccine acceptance. And what we're learning, particularly, and why this is so relevant, this question that you're asking, is that a lot of misinformation is targeted towards communities that are vulnerable and marginalized, so are, i.e., susceptible to misinformation. And so it's really important for us to think about, how do we identify those communities? How do we engage with those communities? Because they are susceptible to misinformation and therefore are more at risk for essentially believing this misinformation. So just another point I want to make.
Great point, and I want to follow up with you, Dr. Lemay, because we've got a question here in Chennai, which says, viewers in Chennai allude to the fact that navigating the ocean of information can be particularly challenging for senior citizens. And I wonder if you would speak to that. I think that's an issue worldwide, the susceptibility, as you were talking, the vulnerability of some of our seniors and our elderly in being able to navigate what is accurate information and what is disinformation or misinformation.
It's a great question. And one thing that we're struggling with here for sure, and what we're trying to do, particularly from a daily sort of briefing type of perspective, and some of our work that Dr. Labrik and I are involved in with regards to the COVID response here in the Baltimore region, is that we're trying to be very, very, very clear that this is the information that we have now, and this is what the information that we have today. We've tried to approach the outreach to our citizens that are in the older demographic through different mediums instead of through social media. So one thing that we have really tried is doing phone calls, direct phone calls, allowing people to ask about misinformation. I understand that's time intensive. However, we do know, as you mentioned, that certain groups are more susceptible. The other thing that is happening is putting flyers of what's true, what are the facts essentially about COVID-19 in phone bills and in utility bills. Those are some of the approaches that we've taken here in the United States, and having a bit of this peer-peer exchange. So especially for individuals that are older in nature and maybe living by themselves and maybe isolated because of the guidelines, we've set them up with a buddy per se, where that they can call on this person who's a medical professional. Actually, it's a nurse in training, to be there as a sounding board when they see something and are unsure about it, to essentially get it fact checked, because they're not going to necessarily go on social media or understand, I guess, the ins and outs of social media to be able to easily discern misinformation.
Thank you so much. That's a great answer. David, you just raised your hand.
Yes, I just wanted to make 2 points to accent that. I think there are, as a general rule, there are often huge generational differences in terms of how people relate to information. And of course, that's going to differ by country and subnational context. So, for example, in the US, we're looking at how people got information regarding COVID-19. There was unsurprisingly a huge generational difference with respect to, let's say, getting news from television of various kinds, where and from newspapers, where it tilted much older, versus social media, and particularly actually different kinds of social media. Interestingly, Facebook was pretty even. Actually, it was an inverse U relationship in terms of age. So younger people didn't use it a lot, and very old people didn't use it a ton, but it was pretty much everyone from their 30s to their 60s, right? There was one other point I wanted to make in terms of interventions. There's one element of intervention, which is how do you get people to be more critical in terms of what they look at and put into their brain, basically. But the other element is can you get people to be more critical in terms of what they share? Right? Because a lot of the engine driving this are these sharing behaviors. And there's some very promising research out of a group at MIT led by David Rand that suggests just cueing people around accuracy, that telling people, just giving them the word accuracy actually changes their sharing behavior. It may or may not change what they think, but it changes how critical they are in terms of deciding to click the share button pretty dramatically, and that in turn might have quite important effects. So where we think about types of interventions that again, cueing people around accuracy in their sharing behaviors might be quite important.
We'll definitely be sure to flag that as we try to promote this Facebook Live as an accurate and astute conversation with our experts. Alan, please, yes.
Just to build on David's point, I think the other the other way that we found media consumers tend to seek out sources of authority that they are comfortable with. So in the case of David's example, people of an older generation might be habituated to looking for authoritative information through television news sources. And as we know, in certain countries like our own, television news has become extremely polarized. And so you can get a very different picture of the unfurling of the pandemic, whether you choose to listen to a ultra conservative news channel or a mainstream sort of central channel or ultra liberal channel. One of the things that we've done at Johns Hopkins is recognizing this tendency of folks to seek information from a trusted source that resonates with them, is to generate content by young people aimed at young people. So rather than have your talking head in a suit show up or in a lab coat and talk at you, we engaged our students who come from that younger demographic to generate content in over 25 languages around coronavirus knowledge and the COVID pandemic, focusing on promoting accurate information, but in a way that is tangible and digestible to that audience. So I think another initiative that countries can undertake is disseminating information across a large spectrum of channels by a large spectrum of individuals. I think not always having the same type of person conveying information is often not very effective. So include young people, include the elderly, include people with whom others in the public can relate, to disseminate that information. I think the other point that I do want to make, we talked about bots and these sort of automated systems to generate misinformation. I will say that there have been good bots in this fight as well, because the WHO and the CDC here in the US have leveraged the power of chatbots. So these automated conversational agents that are able to simulate a human-like conversation to answer questions at any time of the day of people coming to those websites. So if you visit the CDC website or you go on WhatsApp and join the WHO channel, there's actually a WHO chatbot that is filled with up-to-date and authenticated information, who is ready to answer your questions in a narrative and conversational way. And I think that's also been a little revolution in the way we've harnessed some of the technologies that have usually been used to subvert public health to promote public health.
I think that's a great answer. I just want to amplify something Dr. Labrique just said, and that was his mention also of languages. And I'm very privileged to be an American diplomat here in India, where you have 22 major languages, 720 dialects, and the understanding that you need to be able to reach people beyond the platform that we're using right now, which is English, and very happy that everyone who's connecting with us can join us in this way. But how can we connect beyond that vernacular? How can we reach broader audiences? As I mentioned at the top of my remarks, in Chennai, we've been very glad to get to partner with the Asian College of Journalism, which is one of the top-ranked journalism schools in Asia, in creating a handbook for journalists, which we've translated into Tamil, Kannada, Malayalam languages here in South India. But I think that, as you were mentioning, Dr. Labrique, whether it's in the United States translating to 22 or 26 languages, you said you were translating your work into there. I think it's just critically important to understand that if you don't do that, you can also find an echo chamber or a lack of access to information more largely. Can I ask another question here? This is great questions coming from our audience. Why do some people believe misinformation? Is there or are there psychological aspects to reduce stress? And is it a healthy coping mechanism during a pandemic? Like, is there something about us that we want to? I see Rupal, you nodding your head, so I might ask you to answer to start off. But what is the psychology behind the desire to not just receive, but share mis and disinformation? Thank you.
It's a great question. And I think the problem here, as I mentioned before, is that we as humans don't like uncertainty. We're really bad at managing it. It leads to a fight or flight type of a system and response in humans. And so because we're in such an uncertain time, that's really why people are grasping. You know, some of the work that Dr. Labrik and I have done, we have found that the reason that the belief that conspiracy theories are true are very much heightened during political unrest, civil unrest, uncertainties such as pandemics. And that's, like I said, we want to make sense of the world. We do that in a way by reducing uncertainty because it allows us to decide how we're going to move forward with regards to our behaviors. So when there is this much uncertainty, I think people are just, one, grasping for information. The other piece I would say to this is, as I mentioned at the top when we started, is that the accurate information is a moving target. And so as a result, that just really also leads to a bit of disbelief, or maybe just, you know, a little bit less credibility towards scientific experts, because they're saying, you know, 2 months ago, we were told not to wear a mask. Now we're told to wear a mask. So what do the scientists know? And so as a result, people then seek other information that might not be by scientists that have been studying the pandemic, and they tend to believe it, and then they tend to share it because they also want to reduce uncertainty within their networks. It's just a social psychology, you know, sort of understanding and explanation.
Great. And we actually got a follow-up question that relates directly to that, which is that views and opinions in science are changing. What is true today may turn out to be false tomorrow. You gave the masks example. How do we deal with changing science? David.
Can I jump in? And this is, I think this has turned out to be just an incredibly difficult science communication challenge. Science is not truth, right? Science is sort of a framework and a method to try to move towards truth. But that's at best an on average kind of thing, 2 steps forward, 1 step back. And our understanding of this disease has changed, and then it gets transmitted to the public in ways that don't reflect the scientists' own views of the matter. So for example, on the mask wearing, there was really never science that I'm aware of that said mask wearing doesn't help. That was a distillation in part to discourage people from taking masks that might be used in hospitals because those masks were in scarce supply. But in fact, it was a big error in communication up front, and that error came from authorities, did not really accurately transmit even our scientific knowledge then, and then was picked up really uncritically by the media. And so, you know, there is an interesting question also, since the media, traditional media, are actually probably still of you know, greatest importance for much of the world. There's a question of how the media can critically help translate the science out there for mass consumption, whether it's to convey the uncertainties, and of course there's a challenge there. When you convey the uncertainties, do you actually undermine the credibility of the science? But then at least you maintain the credibility when tomorrow we say something different. The other element is also to convey the uncertainty in the science that's done today, because you should never just talk to a scientist, but you should always, especially when there's just something that came out yesterday in a preprint, a non-peer-reviewed paper, that you need to consult with multiple scientists about their views of the state of knowledge. And so having that sort of a journalistic practice is to get multiple scientific perspectives on a given statement or assertion is really important, because actually, in some sense, the most powerful vector for a lot of misinformation, sadly, has been through this bad interplay between media uncritically consuming something that a doctor says or a scientist has found that really doesn't reflect the state of the science in the moment.
And Sunil, can I ask you, thank you, David. Sunil, can I ask you to speak to that? Do you have any comments on that, as that interplay between media and science and government?
Yeah. Generally speaking, and media generally use not especially in I am actually focusing on the media in my country and in my state. Generally, the media persons may not be a persons with a science background, but they need to learn everything while reporting things. But the important thing is that the creating or updating media persons by providing information from reliable sources. That means I can give an example that a lot of news came in my state, in my medias in my state about the recommendations of NASA. NASA is one of the interested case in Kerala where something like that. NASA reports such cases. NASA says like this, and according to NASA, something is happening and something is going to happen. And in such cases, the media person, when such information came to media, they need to check with the people of science, people who are who are working on science, and people who are experts in science, and confirm whether this information is true or false. So such an interface between media and the scientific community will reduce the of or will prevent the publication of misinformation through the media. Okay, such an interface is necessary.
Thank you, Sunil. Thank you for that good answer. One thing that we haven't really discussed is the idea of a science beat. I had the chance years ago to get to know Lori Garrett, who is an authority in the United States on everything from Ebola to now COVID-19, and she is a very much professional reporter. So in developing a science beat worldwide, where it's a really respected field that a journalist can enter and have an expertise that they move forward, I think it's as news media organizations change, it's maybe something that has lost its way. So that's something that we should maybe give some thoughts to. I don't know if any other panelists have a thought on that. I got another question though, which is for those of us who are homeschooling, it's right now in these COVID times, it's particularly important. Could the panel suggest how teachers can incorporate accurate information, or parents from home who are teaching, how they can incorporate accurate information in school lessons about pandemic prevention? Any thoughts about how teachers can do this, even at the primary or secondary school level, how that might be done? Alain.
Well, excuse me, Lauren, I think that there are a number of excellent resources that different public health authorities have put out, from WHO to CDC to the ministries of health of whichever country you may happen to be in, for this specific audience of high school and middle school and even elementary school students. So I would say leverage some of those resources. But actually, it does raise another important point, and it's not just the battle against misinformation doesn't just begin with the consumer and the producer of information. It really starts early in life as we talk about investments made in science education. And I think this is one of the areas which we have seen globally erode as investments in education have declined. The basic understanding of the scientific process is in and of itself endangered. And I think this is partly what has led to the proliferation of some of these massive mountains of misinformation, is that the basic tools, as David so nicely pointed out, of understanding the scientific process, that science is not a system of binary truths and falsehoods. We're constantly making observations. We are conducting experiments to test the underlying connections that we believe to exist between an input and an output, and then we're building I would say a basis to support or refute a particular position in science. And I think people in their secondary school, their primary school training need to be taught about that process. And I think that's one of the, if we want to prepare for pandemics of the future, it's not necessarily in figuring out how to fight chatbots at the front lines. It's figuring out how to inoculate our public early in life, similar to the way we do with the BCG and polio vaccines. We need to start science education early so that our populations are well positioned to differentiate what is true and what is likely created falsehood.
I have to say, so the viewing audience can't see all of us who are in the panelists, but people are nodding very vigorously to what Alain is saying right now in terms of the importance of science education. I just want to put in, I mean, you're at Bloomberg, you know, you're at the Johns Hopkins Bloomberg School for Public Health. We've got David from Northeastern. Are you seeing many students coming in from South Asia, from East Asia? I know that I had the opportunity to meet a great Fulbright alumni here who is on the front lines of COVID-19 up in New Delhi, and he had the opportunity to do some serious work at Johns Hopkins and maintains those really strong ties. So our U.S. exchanges, whether it's the Fulbright program, the International Visitor Leadership Program, the Humphrey program, are all very important, and we certainly welcome students through the F1 visa process to study in the United States. But any type of science collaborations that you know that you're encouraging, or maybe any programs that you're working on here in South Asia or East Asia that you would like to highlight, just very briefly before we move to concluding remarks. Any of you, any of the academics and experts from the U.S.?
It looks like David would like to say something first, and then I'll go.
Well, I just wanted to riff off of what Elaine was just saying about education, and then I'll return to what you were just saying. But I just wanted to say that, for example, in the US, we divorce science education from civic education, right? Civic and historical education is social studies, and then we have science classes. And I think that that's unfortunate, because really science is relevant to our civic life. And that we should be training our students, our K through 12 students, to think about the role that science plays in our civic decision-making, whether it's around topics like climate change or COVID-19, and that we need to think about how critically evaluate, because in some sense, a lot of what we learn in science in K through 12 may not actually feel terribly relevant to our future lives, but in fact, it is quite relevant to our lives today. Yes, and on the question of on intellectual exchanges and so on, certainly at Northeastern we see quite a few students, and I'll note on the other side, this is sort of it's a funny circle for me, because I spent a small but important slice of my childhood in New Delhi, because my mother had a Fulbright fellowship there when I was a kid. So I lived in Defense Colony. So it is sort of funny to think about the role that these kinds of, that was a long time ago, but that these kinds of very important institutions play in knitting together a global intellectual community. So that's my 2 cents there, for what it's worth.
I think to add to David's comment, you know, public health, if anything, is a science without borders. We find ourselves constantly in a condition of travel. You know, each of us in the Johns Hopkins Department of International Health was the first of its kind, and I think every single faculty member is either from a different part of the globe or has spent a substantial part of their lives living and working alongside partners in countries from India to Botswana. And I think the tradition of recruiting and encouraging students and faculty from all parts of the globe continues in a very healthy way, thanks to programs like Fulbright, as well as funding from the Fogarty Institute at the National Institutes of Health, that promote and facilitate these kind of exchanges. So I would say today it's difficult to find a Department of Health or a ministry that doesn't have an alumnus of Johns Hopkins or another comparable US institution. And this global network of public health professionals is really what forms the fabric of public health globally. So whether it's through our online master's degrees programs or very popular summer institutes that are currently going on, I think the opportunity to learn about public health, to learn about the fundamentals of the issues we've talked about today, but also broader issues of how do you strengthen population health can be found online and in communities of practice that span the globe. So we are an international community. Like David, I grew up in Bangladesh. I spent my formative years there, and you know, we are all made of a different fabric, I think, than many disciplines that tend not to be as international.
I think the term public health practitioners, public health professionals without borders is a great, if there's not that organization, I mean, I know Doctors Without Borders exists, Médecins Sans Frontières, so we have to think about, you know, public health professionals without borders. I think it's wonderful that you and David got to spend some time in South Asia and how it's, and continue to work in this area. I want to ask a question I guess I want to ask a question to each of you in conclusion, but we did get a question that I'll ask really quickly in the remaining time. How do we combat misinformation in populations that have low literacy rates or that don't have access to social media? Misinformation leads people to distrust public health policies in those areas. So we've talked about Kerala, which has one of the highest literacy rates in the world. Is there any examples of any of you working in areas where you have low literacy rates, and how do you do that? Do you do it through Instagram? Do you do it through, or I guess, you know, this question is also asking, you know, with low access to social media?
So maybe I'll take a quick stab at this, and I think it's actually a program that USAID launched several years ago when I was living and working in Bangladesh. Was going back to a point that we discussed a few minutes ago, and that is to find sources of information, sources of trusted information for every segment of your population. So the program that I was thinking about when you asked that question was a program called Engaging the Imams. And in many communities, many rural conservative communities where literacy rates may be low, where social media access may be limited, I think the role that religious and cultural leaders play in these communities is a very central one, and one that is often neglected or sidelined. And I think in enlisting the religious communities, church leaders, mosque leaders, imams within the community to participate in this fight against misinformation is central and critical. And so in the program that USAID had launched years ago, it was really focusing on engaging imams and Islamic institutions in disseminating information around reproductive health and maternal and child health. But the very same channel could be leveraged to promote correct information about behavior during a pandemic. And I think we've seen examples of these communities playing extremely important leadership roles during the pandemic, whether in India or neighboring Pakistan and Bangladesh. And we've seen examples of how this community can be critical in promoting a positive set of recommendations. And we've also seen where the failure to engage that particular community can be devastating. Because once you start having large prayer gatherings in the midst of a pandemic, you can be sure that's the epidemiologist's nightmare. So I think do that at your own peril. I think it's a lesson we've learned for the future.
Thank you, Alan. So with the time remaining, I'd like to ask each of our panelists to take about 1 minute and to give any summary remarks that you'd like to give. And I'd like to start, please, with Dr. Lemay.
Sure. No, thank you so much for having us here. I think this is a really, really important topic. I think that from our perspective, again, from a public health perspective, we know it's important. We can do so much with regards to recommendations. We can talk to individuals, but we also understand, and just to I think, expand upon Dr. Labrique's point, I think the main key lesson that we have learned, and we have engaged in almost every country around the globe on behalf of the Johns Hopkins University, is that we also understand that the solutions are very much community-led and should be community-led. I think that as we're struggling with a number of communication challenges that have been highlighted here, from disinformation to misinformation to what's accurate, to who to listen to, who's the authority figure, to what people should do and whether or not they have the ability to adhere to the types of recommendations that their government is enforcing upon them, is that we know from a public health perspective, I mean, it has public in the name. It requires public engagement. It's not something that should be didactic. It should not be something that is paternalistic in nature. It has to be a way that we engage communities in the response. And I think one thing I definitely have learned as a behavioral scientist is that it's important for us to be empathetic. It's important for us to listen more than talk. And I think that if we can do that, and if we can apply that type of approach when we're working in different communities that have different literacy levels, that have different levels of access to information, where there might be equities related to different challenges within certain groups, for example, that if we can take some time and figure out the way that we put community at the center of the solution, then that is the way that we will be able to, one, not only combat misinformation and disinformation related to COVID, but in general public health challenges that we're continuing to see growing, unfortunately, at an alarming rate. So I think, you know, the key point that I would take away from all of this is, how do we listen to the community better? How do we make sure we involve them in the response? And how do we use that as a framing, I would say, in terms of all of our public health endeavors? I think it's extremely important, especially with this reduction in trust towards public health authorities and government authorities going on, that we have to change the paradigm a bit, and we have to be innovative in the ways in which we engage with other folks.
Great. Thank you so much. Thank you so much, Dr. Lemay. I've really enjoyed getting to hear your comments today, and we hope to stay in touch with you. I'd like to turn now to Sunil Prabhakar. Any final words of wisdom, Sunil?
Yeah, thank you for organizing this wonderful program and inviting me to as a panelist in this program. As my fellow panelists said, community activity is the best solution to decrease the spread of misinformation. Even in the state like Kerala, with the highest literacy rate, we use the service of people, celebrities, the religious people or religious leaders, political leaders, to inform people or to make people aware about the spread of misinformation and the problems with the misinformation. So community teaching and the activities like the activities put forward by Google. Google is actually training almost all journalists in the country. They have a program to train almost all journalists in the country in fact-checking. That means preventing misinformation published through the newspapers. So such activities will surely decrease the spread of especially the misinformation and for the mis and disinformations. Okay, thank you very much again in inviting me to the program. Thank you very much.
Thank you so much, Sunil. I was delighted to meet you a few months ago in Kerala, and I want to thank you for all the work that you're doing in Kerala and India-wide to build awareness about this issue of countering disinformation. If I can.
Okay. I hope we will continue the discussion and the things happening here in this part of the world. Okay, thank you very much, Laura.
Thank you. Turning now to Dr. David Lazare. David.
Thank you. First, thank you for having me. This has been a very stimulating conversation, and like I said, it's been nice to to virtually return to New Delhi. It's been too long. I guess there are a few thoughts I have in terms of thinking about immediate responses. To think about how to usefully engage those central nodes in the network that can affect many people. I think one of the things that is quite distinctive about the current moment are these global information structures that touch most of the world. Google, Facebook, and the like. And I think there is a paradox here, which gets to some of what we just heard, which is that so much of an effective response requires local knowledge of cultural practices and many other things, what's credible information, and yet these global structures are often built on scalability. So it's not, I think that many of these companies are still building up capacity in countries around the world, that if you were to say, what is Facebook's research team on the ground in Indonesia say, it's probably not much of one. And so there's a question of demanding from these global structures that they at least develop some indigenous knowledge of cultural practices around information and health. I also would highlight, again, the role of educating media around certain kinds of practices to interrogate science. So don't just go for the dramatic, oh my gosh, everyone's going to die kind of headline, that to think of a set of practices, get multiple experts, how to evaluate, because those are literally the mediators between most people and their content and science is the media. And so how do we educate media in terms of communicating science? And so I guess in terms of thinking about immediate ways to affect knowledge and information, those would be the two kinds of informational structures that really tower above everything else and offer some potential immediate bang for the buck.
Thank you, David. Well, on behalf of Mission India, I want to say you've been gone too long. Come and see us as soon as you can. And thank you so much for your comments today. We've really enjoyed having you and your expertise with us today. I'm going to turn finally to Alain Lebric. Alain, any final words for us, please?
Well, let me echo my colleagues here and thank the mission and the American Center for hosting this really excellent conversation. To quote one of our public health heroes of the day, Anthony Fauci, the director of the NIH, the biggest misconceptions about COVID-19 pandemic are the extremes. The people who think on one hand the world's going to end, and on the other hand, people who don't even believe that it's real. And so the truth is always somewhere in the middle. And I think as professionals, as members of the public, we have a responsibility to try and distinguish truth from sensationalism. And we live in a time when clicks and likes and retweets are the currency of the day, and we have to recognize that the monetization of information is driving a lot of the things that we see on in the media. And nobody likes to be manipulated. Whether you're a conservative person or a liberal person or a central moderate, the concept that your thoughts and perceptions of the world are being manipulated is something that is, I think, fundamentally egregious to most political positions. So I think conveying to the public that a lot of information, so-called information out there, is actually generated purely for the purpose of causing discord and destabilization can be a very powerful starting point. And I think that starting point is promoting individual autonomy in seeking the source of information and the truthfulness. I think as public health professionals, it's our job to state the facts as we know them, and this is something that we will continue to do. Facts and data evolve as information evolves, and I think the best thing that we can be is humble. It's the humility with which we approach this, and as I think Rupali used the word paternalistic, that has characterized sort of medicine and science for many decades. It's our job to remain humble and accessible to the public, making sure we reflect both what we know and what we don't know. And I think with that, I really appreciate that you're pulling us together, and hope for this conversation will trigger a lot more to come.
Absolutely. It's a tough topic, and it's been beautifully covered by our experts today. So I began my remarks today with a quote that was not by Abraham Lincoln, which is actually shared by Alen and Rupali. I'd like to conclude today with one that is by Abraham Lincoln, because his words hold power today, and particularly today. And he said, "The best way to predict your future is to create it." And to this end, and in the hope of a better future that we can create together as we combat this pandemic and other pandemics in our midst, I want to thank you all. I would especially like to thank our wonderful panelists and my colleagues across South and East Asia, including our program organizers, Sarah Zabel and Kathleen Hosey. I'd like to thank our curators, Aga Sodeno, Josh Lustig, and Scott Hartman. I would very much like to thank all of you who tuned in to join this conversation. And I hope you'll stay tuned for more programs on the series Beyond Misinformation, What is False, What is Real. And I hope that together we can take forward any lessons that we've learned today and make some constructive change. Thank you all.
Thank you.